Sounds great. All right, well, thank you again so much for having me. My name is Jeanette Green, Clinical Research Assistant at the Stanford VA Alzheimer's Center in Palo Alto. Again, I'd like to thank you to Mr. Bruce Utech and Ms. Tina Choi for helping coordinate the session and just allowing me the opportunity in our center, the opportunity to speak to you just about our services and just briefly about Alzheimer's and dementia and what it is. So I'm not going to take too much of your time. The presentation is fairly brief, as I had mentioned before. So feel free to raise your hand or write down your questions as we go along. Since our clinicians are typically the ones presenting, I may not have all of the answers to your questions, but I'm going to do my best. And I'd be more than happy to relay them over to our clinicians if there's something I can't answer, okay? So without further ado, let's go ahead and get started with the presentation. So we are the Stanford VA Alzheimer's Research Center. And just a brief introduction. So we started in the 1980s when a team of researchers from Stanford University and the VA, or Veterans of Affairs, Palo Alto, collaborated, and then they were studying Alzheimer's disease and related memory disorders. So we have a couple of memory centers within the VA. So the geriatric center is on the 3rd floor within our wing. And then our center as well. There are plenty also on the Stanford campus. We do have a mix of professors from Stanford as well as VA clinicians that work with us. So our center is also known as the SVAC. We're one of 10 centers funded by the state of California. A few other centers include UC Davis, UCSF, UCLA, and UC San Diego. So there are some services that take insurance. We're the only free center, but the only thing that we don't have are translation services at this time. So we can always refer you out. And I think everyone is pretty much doing telehealth this time because of COVID, but it is quite have that service at this time. So moving on to just the CADCs, or the California Alzheimer's Disease Centers. So they provide, or we provide, diagnostic and treatment services. And these include memory evaluations, assessments, as well as professional training and community education and caregiver training and support. So if you'd like more information just about the California Alzheimer's Disease Centers around the area, you can find information about Alzheimer's disease programs, any statistical reports, and then additional resources for families and health professionals and caregivers. So I do have the website listed down below. I can also share that with you if you are interested. So what is Alzheimer's disease? So this picture just kind of is a good representation and depicts what happens with Alzheimer's disease over time. So you can kind of tell like the seasons, and then by the end of the season, it just kind of deteriorates. So Alzheimer's disease is a progressive disorder of the brain that affects memory, cognition, and behavior. So currently there are 5.8 million Americans that are living with the disease. And we're often asked from our participants, what is the difference between Alzheimer's and dementia? So I'll go over that a little bit later on within the next slides. So some of the symptoms may include memory loss, confusion, disorientation, anxiety, and some difficulty doing daily tasks like following instructions. There is a thing called normal lapses of memory, and that includes forgetting a name, word finding issues, misplacing keys and glasses, and Bruce is pointing to himself, and then some gradual changes associated with aging. So a lot of participants do call and they'll say, oh, like, is this normal? I do misplace my wallet sometimes or my glasses, and I'm really worried about it. So our clinicians have mentioned to us that those are more normal things, more mild memory problems that happen just in regular aging. So moving forward, here's dementia. So dementia is kind of, if you see that image, it's more of an umbrella term to describe a range of symptoms, including memory impairment. So dementia is that overall umbrella term. Alzheimer's disease is the most common. So it's a type of dementia. Other types of dementia includes cerebrovascular disease, Parkinson's disease, dementia with Lewy body disease, frontal temporal degeneration, and mixed dementias. So if you can see the percentiles there on the right side, Alzheimer's includes 50 to 75% of cases, vascular dementia is 20 to 30%, Lewy bodies is 10 to 25%, and then frontotemporal is 10 to 15%. So some risk factors for just dementia in general are age, genetics or family history. So say if your mother or father or any family has had dementia or were diagnosed with Alzheimer's disease, there's just a greater risk to you of getting that as well. Head trauma is one, PTSD, fewer years of education, smoking and alcohol use, having diabetes, and then other vitamin deficiencies. So there have been also cases where a person was iron deficient or deficient in vitamin B12, and then they had noticed that they were kind of having some memory lapses here and there. So those are the types of things to kind of look out for to see if that's contributing to the memory problems. Okay, and then this is where kind of our center comes into play. So if a patient does call or a participant or caregiver calls us, this is where our center can provide our services. So we have a pre-evaluation phone screen. And so this is where we'll conduct, oops, sorry about that, go backwards. There we go. So it lasts about 20 to 30 minutes for this phone interview, and it can be completed by the patient or a caregiver. So if you have a loved one, you can do that for them. So this would include questions to assess the eligibility for participating, and then collecting just some demographic data, very basic health information about the patient's memory concerns, and just basic contact information. So it's not very thorough. We'll do that more at the actual evaluation itself, but this is kind of that pre-screening just to check eligibility. So if a patient is eligible to participate, then a clinical coordinator will help the patient and or caregiver with additional steps necessary to prepare the visit. And then that's just kind of acquiring medical records, lab work, and then any pre-appointment forms that we send by email or by mail. Okay, and so the initial evaluation, this is when you've already been scheduled and then you come in for the actual visit. So it approximately takes 2 to 3 hours. 3 hours is more of an overestimate. If you need more time for the testing at all, if you're coming in for a baseline or, don't really have much problems and you just have more of a family history, but you're pretty, normal in terms of memory, don't have very many concerns, it can take up to like 2 hours to 2 hours and 30 minutes. So we'll go over the consenting process, a neurological and medical examination with our staff neurologist or staff neuropsychologist. And then they'll go over a detailed review of your medications, current medications, and then your medical history. So if you've dealt with any strokes or heart attack or surgeries, they'll go over that with you. And then they'll also go over a neurological exam, and then also cognitive testing. And then the doctor will also give you an a study partner. So say if you are online with your spouse or with, daughter or relative that's there to accompany you for the visit. After you're done with the clinician, you would go ahead and move and proceed to seeing one of the clinical assistants for neuropsychological testing. And that's just more memory testing. So it's just kind of a fancy way to say it. All right. So the post-evaluation, so after that initial meeting, we would set up a second appointment for you to meet with our doctor. But before that happens, we would do a interdisciplinary team meeting with our clinicians to discuss all of the cases, and then a consensus will be made and will be given to you during that family conference time. So this can be done via phone or in clinic. And at this time, it's of course done over Zoom or by phone. And then they'll discuss with you kind of the findings and the scoring and diagnosis of those testing materials that you went over initially. And then also the doctor will refer you out, if you are eligible, to any other community agencies, like senior centers, any other research studies that we'll go over a little bit later as well. And then recommendations to your primary care physician. So if you need any treatment or if there's any medication changes that you might have, then the doctor will then refer back to your primary care and say, so-and-so came in and they need a change in medication, or we need to alter that or lower the dosage or up the dosage or whatnot, or take you off a certain medication. So there's no actual treatment, like we can't treat you, but your primary care doctor will do that. Okay, and then also you can be involved in educational seminars, which we have as well, and then any follow-up contact as needed. So those are all also free of charge. So our follow-ups usually take place within 6 months to a year. So you can feel free to contact us within that time period, or if the doctor recommends that you come back a year from now, then we would go ahead and give you a call a year from now to go ahead and schedule that appointment. Okay. And so this referral or eligibility, so you may be referred by yourself, so you can come and if you find us online or are referred by your doctor or family, any community agencies like senior centers or Avenidas, or your personal physician. So anyone can be eligible or anyone can come from anywhere to see us. And then any individual whose primary problems may result from a dementia. So if you've already been diagnosed with dementia or need a second opinion, you can be seen for either a baseline or that second opinion. Or further information. So a lot of people will also come in and say, you know what, I was seen by my primary care physician. I was only given a 15-point or 30-point questionnaire. I would like something more comprehensive. Then you can come to see us as well. Okay, and then we see veterans, even though we're at the Veterans of Affairs, we see veterans and non-veterans. So we're completely open to the community. Okay. Some financial considerations. There's no cost for the services provided. Just reiterating that. Any additional scans will be done through your primary care physician. So if the doctor does request any lab work to be done or MRIs or CT scans done, that would just be done through your private insurance. We can make that recommendation to them. And so we would just tell them that you're being seen for a memory evaluation. So that would be necessary. Okay. And so here's the COVID-19 modifications via telehealth. So, so prior to this, we were seeing patients in clinic. So we've been really lucky to be able to change things and do things via telehealth. So you can be in the privacy of your own home. You don't need to travel during this time. So everything will be done via Zoom. conference or by phone. So say a person doesn't have access to a computer, it would be a limited evaluation, but we can still do it by phone. So all of the visual aspects of the testing, we would go ahead and omit those, but we can still do at least partial testing for those individuals. And so this is our current team right now. We're fairly small, but very diverse group. Okay. And so as mentioned, we're doing it securely through Stanford or by phone, and it's a modified neuropsychiatric testing battery. So our clinicians did really a wonderful job transitioning us from that in-clinic testing to all telehealth. So they really did pick and choose which ones would be best for our participants. And then also follow up in person if available. So later on in the year, if you want to come to see us in clinic, once COVID has kind of settled down, you can feel free to make an appointment, or we can make that appointment with you. And then moving on to our related studies. So these are kind of the studies that are going on currently within our clinic. So we have Dr. Joy Taylor, who's doing a RTMS study. So RTMS is repetitive transcranial magnetic stimulation. So it's a brain stimulation to improve memory and mild cognitive impairment. So these are for participants who have a decline in memory, but are in fairly good health. And then someone can attend with them for the study visit. So if you have any past medical history of mild cognitive impairment, or have just some sort of decline, you can feel free to contact them, and they have their information down below. We also have Dr. Peter Bailey, who's doing treating chronic pain with yoga. And these are 12 free teleyoga sessions. Some eligibility protocol here is if you have a diagnosis of Alzheimer's disease, have chronic musculoskeletal pain, and then you need to participate in the yoga sessions. So again, we're kind of that first step to see if you have a loved one who has already been diagnosed or will be diagnosed, they may be eligible to participate here. Okay, and then so Dr. Makoto Kawai, he's actually one of our neurologists that do see participants. He actually does a sleep study, so he is a doctor for sleep. So if you have any sleep apnea issues, insomnia, or just have trouble sleeping or snoring, he would be a great person to see and to connect with. So the purpose of his sleep and NIRS study is to examine measures of brain oxygen levels simultaneously. So there is a sleep assessment for that. And then the eligible participants are healthy individuals with or without sleep disordered breathing and over the age of 60 years old. And they also have their phone number down below, which I can forward to you if you're interested. Okay, the next study that we have is the Water Vet study. So this one is available for veterans only who are 50 years of age or older and experiencing memory problems. It's eight months long, and you do get compensated for this as well. And it's aerobic exercises through the swimming pool. Okay, and so moving on to our community education seminars. So this is really great. We just started this last month, actually. That was our first time coming back and doing it via telehealth. So these happen on a quarterly basis. So we do have one coming up in, I believe, next year in either late January or February. It is open to the community and to professionals. It's completely free of charge. And it's going to be with Dr. Quinn Kennedy, and she's going to be discussing mindfulness and aging. If you all are willing to participate or are interested or know somebody who's interested in mindfulness and aging itself. So we'll post that on our website, which is listed down below there. And then we can also email you the information if you'd like to contact us directly. Okay, and this is our contact information. So we are located at the VA Palo Alto in on campus. So we're at Miranda Avenue in Building 4. And our mainline number is listed there as well. The best way to reach us is by email, as you all know. So please feel free to email me at that email address, and then or visit our website there as well. Okay, and that is pretty much it. That's the end of our presentation. Are there any questions at all? Yes.
What is Lewy body's disease?
Lewy body. So
Lewy, sorry.
Lewy body. So there's different types of the dementias. So some of them, I can't really pinpoint exactly what it is, but I'll tell you a little bit of symptoms. So some people who are dealing with Lewy bodies, it's more of the paranoia. There's a lot of paranoia, hallucinations happen as well. But it's just another type of dementia that I can send more information to you as well. Yeah.
So it's kind of broken down, I guess, dementia into forgetfulness, and then sometimes neurological, where you have muscle forgetfulness, I guess. It's
yeah. So a lot of them deal with like cognition issues as well. And so like, for example, for figures, if you're working with like a set of blocks or puzzles, not knowing like a dimension or like seeing the actual puzzle piece. So there are certain like things that your brain you can't comprehend, especially when you have that type of dementia. So Lewy body is just another form. Like there's just certain symptoms within that where they can say, okay, this looks like a Lewy body dementia. They're hallucinating, they're having, they're seeing people that are not really there, certain things like that where they can pinpoint certain things, and then they can declare whether or not it's that type of dementia.
Okay, thank you.
Yes.
Do you have a mandate to report to the DMV if somebody is diagnosed with Alzheimer's?
Yeah, so that's a great question. So if you are diagnosed with Alzheimer's or dementia, we would be required by California law to report to the local Department of Public Health, which will then forward that diagnosis to the DMV. And so they would assume that responsibility, but they would ask you to retake the license test to determine your driving ability for your own safety as well as the safety of others. That's only if you're diagnosed with Alzheimer's or dementia. If it's a mild impairment, like mild cognitive impairment, that wouldn't count as that, so we wouldn't have to report. But in those cases, the DMV usually takes a look at what stage the person is in. They'll allow that opportunity to take that test, but if a person is in the farthest stage of Alzheimer's disease and really has no recollection of like who, if they're even talking to a family member, I think that's when they would say, okay, well, we would have to take responsibility for this person's driving. Yeah. Yes, Yolanda. Oh, you're muted.
Okay, so what would be the first step for a caregiver that has a parent with dementia, calling you or emailing you, or what's the first step?
Oh yeah, definitely. That would be the first step. So you can contact us by email. I can put that back up on the screen if you want that, or you can call us, whatever is more convenient. I know some people have trouble emailing, and so calling is much better. But let me go ahead and put that back up just in case. I'm sorry. I can put that up back in just a moment. I'm sorry. My
friend is taking care of his mother, and she is highly confused and is showing signs of dementia. And he's getting to a point where he doesn't know what to do.
Okay, yeah, then definitely give us a call. He most likely will probably contact me. I'm usually the ones to help schedule the appointments. So feel free to forward him our information.
I'm
And
sorry,
then
what was your name?
Jeanette Green.
Okay, great, thank you.
My pleasure.
Leave that up for a second.
Sure, I will. Oh, and Sally, does Sally have a question?
Do you know if there have been any studies on general anesthesia during surgery, how many of those you've had in a lifetime, and how that's related to memory loss?
I am not sure of that. Yeah, I'm not quite sure. I do have a link to all of the papers that we've written. So I can send that over to Bruce and he can send it to you all if he'd like. And you guys can kind of look over what kind of topics we've gone over in the past. But that's a really great question. Yeah, that's something really, really interesting.
Always thought about it.
Yeah, definitely.
Another question,
Sure.
can you elaborate on the genetics and what were some of the other indicators that
Sure.
that you're more likely to have Alzheimer's?
Mm-hmm. So we've also had participants in the past. I don't know if you all are familiar with the APOE4 gene. So that gene is it's linked to Alzheimer's disease. So again, it's APOE4. And some participants have gone over genetic testing, and so they'll call us and say, "Oh, hi, I got genetic testing done, and I was told that I have the APOE4 gene, which increases my risk for it. Will I get Alzheimer's disease?" There's no real known fact that you will be, diagnosed with that. It just makes it you're at greater risk, but you're not guaranteed that you're going to get Alzheimer's disease. Just like, those who, I think it's the same like with the dementia. There are certain dementias that are reversible. So some memory loss can go away with the proper treatment. So a lot of people don't know that. And so it's really a great, I think, step if you are having some mild problems to be seen. The information that we do with our initial evaluation, this information goes straight to you. So the report only goes to you unless you ask us to send it to your doctor. So it's really private in that sense. And it is, you're pretty much a participant and are a number for us. So there's no, it's confidential in that sense as well. Mm-hmm.
I'm surprised that there's not an HTTPS colon.
Oh, right.
Not good. I didn't see the S there.
Oh, yeah. So that it shouldn't have an S. Yeah, http://med.stanford.edu.
No, the problem is that it should say HTTPS colon to be secure.
Our last class was a computer security email class.
Oh, wow.
Good job, John.
That's awesome. I could have used that as a test question then.
Yeah, that's right.
Yeah, huh?
No, but I'm sorry I got late. I got here late, but my wife has dementia. I was in the Navy, but does it matter that she wasn't in the Navy or in the armed services for this service?
So so you said you were in the veteran,
Well, I was in the Navy back in the old days, yes.
So when we do see veterans or family of veterans, it just kind of widens the amount of eligibility. As you saw, with our certain studies, that it's like for veterans only. There's some that are veterans only, or family members of veterans. So it just kind of widens the range, since our services are open to the community.
Because my wife has got dementia and she can't, wins and wheres are going, process, driving, cooking, all that kind of stuff is going. So I'd be very interested in your services.
Sure. Yeah. And you can definitely be seen. You can follow it over time. As I had mentioned, I don't know if you stepped in after I had spoke about this, but if you would like her to be followed over time, just to see if there's things that can change with treatment options that the doctor recommends, then you can see us every year. And that just is how we kind of flow. That's how you'll see kind of an increase or a decrease, or just kind of the progression of how you're doing.
She's having great difficulty walking at this point.
And our neurologists do give a neurological exam. So they'll check balance and gait. They'll go over just some, typical things that you would see if you're having kind of memory issues or eye impairments or something. So they'll kind of do over the tests where they'll, check your vision and gait and balance. Okay. Any other questions?
Well, nothing. Okay, Jeanette, thank you so much.
It
Thank you.
is
Very
my
valuable
pleasure.
information.